If a woman has obesity and diabetes, she has quadruple the risk of having an autistic child. But I want to go deeper, and most people don't know this. Something horrible has happened.
Dr. Chris Palmer,
the Harvard psychiatrist
whose groundbreaking new research could be the missing piece to cure the mental health epidemic.
Mental disorders are the leading cause of disease and disability worldwide. Governments are actually labeling them as terminal illnesses and to allow people to die by assisted suicide. And they're going to allow them to die because they know what I'm saying is true. They know that our treatments fail people year after year after year. And what I'm here to say is you can, in fact, get better.
How?
I struggled with mental illness myself for 20 years. I tried to kill myself several times. There was no hope for me whatsoever. And I was furious with the mental health field for being so incompetent. And I wanted to try to help. And the thing that people have not opened their eyes to is the science of metabolic health. And there's tiny things in our cells that can heal and recover people who have had chronic, horrible mental illnesses.
Really?
Yes. And if autism is genetic, it shouldn't quadruple in 20 years. These are facts, and we can do something about it.
Chris, when people say to you, or when people say the quite common rebuttal that the reason we're seeing this rise in mental health disorders is just because there's more of a conversation about it, so more people are stepping forward, we now have a word for it, so there's just more labeling, and these mental health disorders, like the ones you've named, and even things like ADHD and autism, it's just because there's more conversation going on. And these things aren't, in fact, increasing.
That is a common argument. And I would argue that it's like just putting your head in the sand. The easiest place to get an accurate read on the true prevalence of mental illness, and not just the recognition of it, but the true prevalence of it, is to talk to school teachers who've been teaching for more than 30 years. If you ask them, were you just not recognizing the children 30 years ago who are screaming and tantruming in your classroom? Were you just not recognizing the children who were melting down when they got bad grades and injuring themselves in class? Were you just not recognizing the level of despair and anxiety that you see in children? Did you just have your head in the sand back then? And now, since everybody's talking about it, you see those behaviors, you see those symptoms. The school teachers and the guidance counselors will laugh at you and say, no. Something has happened. Something horrible has happened. I wasn't ignoring mental health 30 years ago. I wasn't ignoring despair 30 years ago. I wasn't ignoring extreme anxiety and panic. I wasn't ignoring tantrums in my classroom 30 years ago. They are skyrocketing.